This video, I'm going to go over all of the muscles that we have in the chart that I gave you. I'm going to focus on the origins and insertions to help you to kind of realize the actions that will result as a result of essentially the muscle pulling from the origin on the insertion. So the first two diagrams that we have here are going to be ones that you need to know, essentially, just for the locations of these muscles. With few exceptions, almost all of these muscles you need to know. Okay, so that was the anterior view. This is the posterior view. Make sure that you know the muscles that are represented in each of these diagrams. So we're going to start with the head, and the first one that we have in our list is the epicranius. And essentially, there are two parts to this overall muscle, with a big aponeurosis in the middle of it. Okay, so the origin is here, the insertion is here. So when this contracts, it's going to pull up on the eyebrows. So that's the action of the epicranius. Next, we have the orbicularis oculi, which is a circular muscle around your eyes, and the origins are the frontal bone and the maxilla. The insertion is the skin around the eye. So when this contracts, it's going to close your eye like a blink. The orbicularis oris is another circular muscle around the mouth, and its origin is other muscles near the mouth. The insertion is the skin of the central lip. So whenever this muscle contracts, it is going to close the lips, kind of like pursing it, getting ready for like a kiss. Next, we got the zygomaticus muscles. We have the major, which is the larger one, and the minor here. So the origin is the zygomatic bone up here, and the insertion is the corner of the mouth down here. So when this contracts, it's going to pull the corner of the mouth up in a smile. On the other end, we have the platysma. So it's kind of a large sheet-like muscle. So its origin is down here in the upper portion of the chest. The insertion is, again, the corner of the mouth and the mandible. So anytime this muscle contracts, it's going to help to pull down the corners of the mouth in more of a frown. So this works opposite to the zygomaticus muscles. The masseter has its origin up here in the zygomatic bone and insertion down in the mandible. When this contracts, it's going to elevate the mandible, which is really important for chewing. Temporalis is the same way. So it also inserts into the mandible, but its origin is up here in the temporal bone. And it will also, when it contracts, elevate the mandible to assist in chewing. Our last one that we have here is more of a neck muscle, but the sternocleidomastoid comes up in kind of like a diagonal line from its origin down in the sternum and clavicle up to the temporal bone here in the mastoid process. So that's where this name comes from: sternum, clavicle, mastoid process of the temporal bone. But like I said, it comes up in a diagonal. So whenever it contracts, it is going to help to rotate the head. And you have one here on the right side as well as on the left side. So you can turn your head to the left and to the right. Now, looking at the back, we'll start up with the trapezius, which is kind of a diamond-shaped muscle. So they've cut away half of it over here. But the origins are the occipital bone as well as some of your cervical and thoracic vertebrae, and the insertion is going to be in the clavicle and scapula. So the traps, the action that I kind of focused on was just the raising, so the elevation of the scapula and like a shrug. But the traps they really do a lot to move around the scapula. Next, you have the rhomboids. So the rhomboid major and minor. And so the major is the larger one, the minor is the smaller one, a little bit more superior here. So the origin is the vertebrae here, and then the insertion is into the scapula, and these muscles will help to retract and elevate the scapula. Okay, so you can see them here. You can also see them a little bit zoomed in, I guess, on the opposite side. Okay, our next muscle is another one that is going to, I guess, manipulate the scapula. So the levator scapula, hopefully you realize what it's going to do, but its insertion is here in the cervical vertebrae. Origin in the cervical vertebrae, insertion down into the scapula. It will elevate the scapula. The latissimus dorsi is going to be our first one in the back here that does not move the scapula around. So its origin is down here in the sacrum, and then also in the lumbar and thoracic vertebrae. And it inserts into the humerus. So the latissimus dorsi is going to help with manipulating your shoulder, and it will extend and adduct your shoulder. So essentially extension is going to be like a pulling motion. So pulling it towards you, pulling your shoulder towards you. Next, we got the teres major, which is a much smaller muscle, but does same motion as the latissimus dorsi. So it helps with that motion of the pull. But its insertion is, its origin is in the scapula. Its insertion is the humerus. The deltoid also inserts into the humerus, but its origin is the scapula and the clavicle. And the main motion that I want you guys to know about is just the abduction, so the movement of the shoulder, moving the arm away from you to the side. But the deltoid it performs a lot of movements just because of the different heads that it has. So it will also flex and extend at the shoulder as well. Okay, now looking at the front here. So we've already seen the sternocleidomastoid, but now you can see how it inserts down here in the sternum and the clavicle. Okay, and then comes up kind of like in a diagonal to the side of your head. The trapezius, you can see how it attaches here to the clavicle, and then the deltoid, looking at the front view, essentially it looks like a big triangle all the way from the front of your shoulder to the back of your shoulder. Okay, and then the insertion is here in the arm. So the first one that we're going to look here is a very large muscle, the pectoralis major. Its origins are the clavicle, the sternum, as well as some of the costal cartilage from your ribs. It inserts into your humerus, and while the latissimus dorsi would extend your arm, the pectoralis major flexes your arm at the shoulder. So a pushing motion, as well as also bringing your arm across your body in an adduction movement. Next, we have the pectoralis minor, which is smaller, deeper to the pectoralis major. You can see that its origins are these ribs right here. The insertion is in the scapula. The serratus anterior are the same way. They just attach down here to different ribs, but they also have insertions into the scapula, and both of these sets of muscles will depress and protract your scapula, so moving them forward and downwards. Next, we got all the abs. So I'm just going to kind of point out, we're going to look at them again in a little bit, but the rectus abdominis, these are like your six-pack muscles. Notice how the fibers are going straight up and down like that. The external obliques and the internal obliques, the fibers are going in diagonal form. So the external are going like laterally to medially downwards, whereas the internal obliques are going the opposite way. So going, from lateral to medial, they're going upwards. And then the transversus abdominis are going horizontally. So the important thing here is that the fibers are going in different directions, and that really helps with the stability of the abdominal muscles. All right, so we've seen a bunch of these already. So looking from the back, we got the levator scapulae, the deltoid, and the teres major. The new muscle that we're looking at here is in your brachial region. That's the triceps, looking at the back of your arm. You can see that we have the triceps brachii here. So the origins are the scapula as well as the humerus. So scapula, humerus, and then it will insert down into your ulna. And whenever you contract this muscle, it will extend your elbow. All right, so again, we've seen the deltoid and the trapezius. Now we're looking at the front of the brachial region, the anterior, and now we can see the biceps brachii. So we can see the two heads, and its origin is up in the scapula, and then it inserts down into the radius. And so the biceps brachii, whenever it contracts, will flex your elbow. And then the other muscle that also helps out is the brachialis, and that is going to be posterior here to the biceps brachii. We'd have to cut it away to see it. It will do the same thing, but the brachialis, instead of originating in the scapula, originates in the humerus and then inserts into the ulna. But it does the same motion. It flexes your elbow, and actually the brachialis is able to generate more force than the biceps. So the biceps are more the glamour muscle. The brachialis is the worker here. All right, now looking at the forearm, we'll be able to kind of see the supinator here. It's kind of like a strap that goes across the arm, and that will help to supinate, so facing your palm upwards. And then you actually have two pronator muscles, so the pronator teres, which if we were to cut away the other forearm muscles, we would see here, coming from the humerus and ulna across to the radius. And then same thing with the pronator quadratus down here. It also originates in the ulna and then inserts into the radius. So these will help to turn your palm downwards in the pronation motion. So that's nice and easy. And I think the last one that we have on this slide is the flexor carpi radialis. So you can see that muscle here. So flexor carpi, it helps you to flex your wrist, and it originates in the humerus up here, and then it comes down and actually inserts into your metacarpals. All right, again, looking at the forearm, now we have the extensor carpi ulnaris, and this will do the opposite of the flexor carpi radialis. It will help to extend your wrist, and again, it originates up in the humerus and then inserts down in your metacarpal, and it will extend your wrist. Then we have the extensor digitorum. So that one's nice and easy. It's going to help to extend your fingers. And again, so this muscle actually originates up in your humerus, very similar to where the extensor carpi ulnaris is, but instead of inserting into the metacarpal, these will actually insert into your phalanges. All right, so now looking at the abs again, so just take note of the fibers and the direction that they're going in. So the rectus abdominis is the first one here. And if we were to look at a cross section, it's going to be in the center. The thing to take note here is that the external obliques are actually the most superficial of the abs, and then we kind of have like a tie between the rectus abdominis and the internal obliques, and then the transversus abdominis is the deepest of the abdominal muscles. But the rectus abdominis, it originates down in the pubis portion of the coxa bones, and then it inserts up into your sternum and costal cartilage. And whenever this contracts, it flexes your vertebral column. The external obliques, they originate in your lower ribs up here, and then insert into your coxa. So if we're looking here, come down and insert into your coxa there. And both of your obliques help to provide tension in your abdominal wall while also being able to rotate your vertebral column to the left and to the right. So the internal is going to be the opposite. So its origin is actually down in the coxa here, and then it inserts down here in your lower portion of the coxa, as well as the costal cartilage of your ribs up here in the linea alba, which is the connective tissue that you have towards the center of your abdomen. And then the transversus abdominis, again, the fibers are going horizontally. The origin is your lumbar vertebrae, so it actually comes all the way from your back, and it will insert into your coxa and, again, the linea alba. Okay, and the transversus abdominis helps to provide tension in the abdominal wall, just like all of your other abdominal muscles. Sorry, I didn't highlight these ones. There you go. All right, now, finally down in the leg, we're going to start off with the iliacus. And so its origin is up here in the ilium portion of the coxa, but then it is going to insert down in your femur. It helps to flex your hip, so bringing your leg up from the hip in front of you. Next, we have the adductor longus. That's an easy one. It's going to help to adduct at your hip, but you can see here how its origin is up in the pubis portion of your coxa, and it inserts into your femur. So when it contracts, it'll help to pull your leg closer towards your median in the adduction motion. Next, we got the sartorius. So it's kind of like this strap-like muscle that comes across all the way across from your upper portion of the coxa down into actually your tibia all the way down here. And whenever this contracts, it will help to abduct, so moving your leg outwards, and also laterally rotate at your hip. Next, we've got all of our quadriceps muscles. So the rectus femoris here, that's the most prominent and anterior portion of your quadriceps. Then we have the vastus lateralis. Okay, so that's going to be the lateral muscle here. The vastus medialis, that's going to be the more medial muscle. And then the vastus intermedius, if we were to remove all the other ones, this would be underneath all of those ones. Okay, but these four muscles, they make up the quadriceps, and they do have slightly different origins. So the vastus muscles, they actually originate in the femur, whereas the rectus femoris actually originates up in the coxa. But they all join together in the patellar tendon here, where it will actually come down, engulf the patella, and then become a ligament where it then will attach to the tibia here. So all of the quadriceps, they come together to form this tendon. All right, so we've seen the sartorius, rectus femoris, and vastus lateralis. This is just a lateral view. Now we're going to be looking at the glutes. So the most prominent one is the gluteus maximus. And the gluteus maximus, it has its origin in the sacrum, coccyx, and the coxa, so towards the center of your body here. And then it will come down and insert into your femur. The gluteus medius, you can see here, is slightly smaller, but it's more lateral than the gluteus maximus. And then the gluteus minimus too is also lateral. You would have to remove the gluteus medius to see the minimus. But all of them insert into your femur. The gluteus maximus helps you extend your hip. So essentially going from a crouch position or a squat and straightening up. And then the gluteus medius and minimus both abduct your hip, so moving it outwards. Okay, and that makes sense because you can see when this contracts, it's going to help to move your leg away from your midline. Okay. The other new muscle that we can see here is one of your hamstrings muscles that we'll focus on in a moment. That's the biceps femoris. All right, so now looking at the back, we can still see the gluteus medius and the gluteus maximus. You can see the vastus lateralis covered by the fascia, as well as a portion of the sartorius. But now we're going to focus on our hamstrings. So we have the biceps femoris. There is a long head and a short head. Okay, so just like the biceps brachii, biceps femoris have two heads. The semitendinosus is going to be the more medial muscle here from the biceps femoris. It's also part of your hamstrings. And then the semimembranosus is your third hamstrings muscle, and it is going to be anterior to these other ones. So you would have to kind of cut away the semitendinosus, but you can kind of see it poking out here from behind it. Okay, but all three of these muscles, they make up the hamstrings muscle group. And we will focus in a moment on the gastrocnemius, which is also one of your calf muscle group. All right, so now looking down at the calf, the gastrocnemius has the two heads. This is essentially what you see from the outside. But the gastrocnemius has two heads, the medial, which is towards the middle, and then the lateral, which is towards the outside. The soleus, which is anterior to it, is also part of your calf. And then the plantaris, which you can also kind of consider to be a part of your calf, because they all form the Achilles tendon down here, which will attach to the calcaneus. And all three of these muscles perform plantar flexion. But the plantaris, which is up here and actually originates in the femur, can also help to provide some flexion in the knee. Right? But the gastrocnemius also originates up in the femur, whereas the soleus only originates in the fibula and the tibia. But yeah, you can see the soleus here alone away from the gastrocnemius. Okay, and then the plantar is here. Okay, calcaneal tendon, aka the Achilles tendon. Then we have the fibularis longus. So this is a muscle that's going to run alongside the fibula to the outside, and it will originate in the fibula and the tibia and then run down into the tarsals and metatarsals. And it provides a few different actions here, like plantar flexion and eversion, but it also helps to support the arch of your foot. The tibialis anterior, so this is going to be the front of your leg, but the tibialis anterior is a muscle that will help with dorsal flexion, so the opposite of your calf muscles. And its origin is the tibia, and then it inserts down into the tarsals and metatarsals. And then we have the extensor digitorum longus. So this muscle will actually extend your toes. But you can see here it comes all the way down, and it would then insert into the phalanges. Okay, and then, sorry. So looking at it from the side, we can see the tibialis anterior. We can also see the fibularis longus a little bit better here to the side, as well as the extensor digitorum longus, which comes all the way down and then will attach to the phalanges. And then the calf muscles from the side too. Now, I'm actually going to go back a little bit because I realized that there were a few things that I skipped in terms of actions. So your quadriceps, they will help to extend at your knee. So straighten your knee out. That's a really important function of your quadriceps. And then the glutes, I explained what they do, but the gluteus maximus helps to extend at the hip too. And then the hamstrings will actually do a few different things just because they have their origin up in the coxa, and then they insert all the way down into the tibia down here. But they provide not just flexion at the knee, so curling your knee, but they also help to extend at the hip as well. And that is all for this video. So I hope that you found this helpful. We will review this a little bit more tomorrow, but have a nice day.